Good morning. Hope you all had a wonderful Dasara vacation. I mean, a continuation of a vacation already, but we had a good Dasara. We did have a nice Dasara. Okay, now let us return back to our study program. Today we will discuss something about the practical aspects. That is, in the practical, you might be asked some questions or given an experiment, or they may show you some organism at a microscope and give you certain reactions and ask you to interpret. So now what we are doing is interpret more in a clinical background. 40 years ago, when I was a student, all textbooks used to be written about microbiology. The Staphylococcus, what does it cause? What enzymes does it have? Or Streptococcus, or Pseudomonas. So it used to be oriented towards the organism. But when I went for a medical education training, one of the subjects, Dr. A.K. Krishna, he asked, Bala, don't you think it is high time the textbooks of microbiology became textbooks of clinical microbiology and organisms causing, say, gastritis, organisms causing meningitis, organisms causing earache, something like that. Then you think of all viruses, all parasites, all microbial agents that might cause ear pain, which parts of the ear are affected. So that is how today we think about a practical problem. Sudden pain in the ear or chronic pain in the ear. Maybe acute suppurative otitis media or chronic suppurative otitis media. So how does acute suppurative otitis media present? Otitis media is something to do with the pain in the inner ear. Behind the eardrum, there is accumulation of pus. As you know, the eardrum is connected with the throat by eustachian tube. So there is some accumulation of pus and it is trying to come out and there is no way, and then you have terrible pain as if the eardrum is going to rupture. The patient will say, Doc, there is something wrong in my ear. It is throbbing pain and it looks like if it ruptures, I'll have relief. Actually, my son had such a problem when he was 26 or 27 years old. And midnight 3 o'clock, I woke up Dr. Prof, the ENT surgeon, and moved to the meningitis. That is a clean knife incision of the eardrum, tympanotomy, and released the pus. And it's a clean wound and healed without any problem. So now today we are going to see something about chronic suppurative otitis media. So this is why I kept the figure of a person suffering earache. Maybe SOM or CSOM. So now we have a gram-negative organism which is causing all these things. Proteus, usually Proteus. Protea, we have so many genera under it, Proteus, Morganella, and Prodentia, but we are worried about Proteus. So genus Proteus and 4 species we have Mirabilis, vulgaris. Usually it will be Mirabilis or vulgaris. Exophagians and Penary are other species. species. And Proteus is motile, that is, it can move. But how do you see whether it is having flagella or not? You can do a flagella staining. You can see the flagella. Enough for undergraduates if you know that some process is available to stain the flagella staining. Okay, under electron micrograph, you can see fresh stains of either Proteus or Pseudomonas. You can do a flagellar staining, and that's how you see. And if you can recollect your classes on Proteus, gram-negative cocobacilli 1 to 3 micrometers length, arranged singly or in pairs or short chains, and young cultures, long curved filamentous forms are seen, motile by peritracheate. Peritracheate flagella, you remember Salmonella. So they are motile by peritracheate flagella, and fimbria for attachment will be there. And non-motile, non-flagellate variants do exist. This you have to remember. So flagellar stain, please remember about that. Once you do that, that is the way it appears. This is obviously an electron micrographic picture. And these are the flagellae. Once you enter a Burns ward and there is a characteristic putrefactive odor, or once you enter, or anything caused by Proteus is having a fishy or semen-like odor. So it grows on ordinary media, solid media, swarming. This can be a Sharp's question. This is already covered in theory. It's only a reminder that swarming is a type of growth. And how can you inhibit swarming? Increase in the concentration of water. Imagine yourself swimming in a clear water. You can swim very happily, nicely with your original speed. But if there's a lot of mud, your speed is reduced and you cannot swim so easily. Likewise, increase in the concentration of water, or you incorporate certain agents. How to remember these agents? Suppose a man is under the influence of alcohol. He will be slowing down, like his mental reflexes and all to slow up. Okay, so chloral hydrate is used for sedation of children. Alcohol, adults also get kick or slowing down and sleep. Likewise, you remember chloral hydrate, alcohol, sodium azide, boric acid, sulfonamide are surface active agents. So these things, if you incorporate in the media, it becomes less speedy, and that is why you can see the swarm. You see? So, in your 8th class or 9th class, if you remember, Vidala Bija Kandamam Addukota Patam. You know, like if you do a cross section, a horizontal cross section of a tree, you see growth rings, you know. It is about the history of the growth. Vruddhi Valayalu Anevadu. Okay, growth rings. So that shows the age of the tree, and botanists derive a lot of things from it. But if you inoculate Proteus, a swarming variety, this is how you can see, you know. So in the center you have inoculated, and you see growth ring type of. That is why, because of the edge is growing and one pattern. and again another ring, another ring. So this is how the movement of the bacilli is indicated. And you can see the swarming pattern. Okay, so blood agar, nutrient agar. And around the colony and around the surroundings, you see extra, like ఒక మేఘాల్లో ఉన్న చందమామ లాగా, you can see the extra growths. And if you tilt the agar plate a bit like that, you can see the growth much easily. Okay? Straight ahead, if you see, you may not appreciate the growth. But your sense of smell, if it is correct, you can easily identify. But you should not take the growth to your mouth and to your nose and identify, try to identify. By the very smell, you can identify. It smells fishy. No, it's not something fishy, because something fishy again is different in English. Okay, ఏదో అన్యాయం జరుగుతుంది, అక్రమం జరుగుతుంది అన్నప్పుడు we use something fishy. But fishy smell అంటే Proteus infection ఉండొచ్చు, or semen-like smell ఉంటే Proteus ఉండవచ్చు అని you can guess. See now, so this is the growth of, the real growth of Proteus. You can see in a plate. We have one more important thing. Non-motile variants, they do not swarm. Mechanically, smooth colorless colonies are seen. And Dern's phenomena, this is very important, used to determine whether various strains are identical or non-identical. For example, if two strains of the given Proteus are same, they merge. You know, just like you see in precipitation, the arcs are not cutting each other. Okay? So here also you can see whether they are identical or non-identical by Dern's phenomenon. Biochemical reactions, they will provide you a set. So this is how you identify. Sugars ferments glucose only with acid. GLS, MMX, glucose, lactose, sucrose, maltose, mannitol, and xylose. This is the set given. And you can see only glucose, that too with acid. Imbic reaction, indole, methyl red, ox, prosper, and citrate. What is this D? You know, plus plus minus minus, or minus minus plus plus, like E. coli and Klebsiella. But this D is powerful. It is variable. Okay. So methyl red is positive, but Ox, prosper, and citrate are negative. Urea is positive. That means urea's production is there, and so we will put a positive urease test. And negative Ox, prosper, and citrate. Okay, that too citrate is a medium, solid medium, so we put a citrate. PPA, this again phenyl deaminase test, the theory part of it which we already been covered. So PPA, if we put a medium PPA, actually for postgraduate studies only we put PPA medium. H2S production, how do you identify NTS agar, triple sugar iron agar? You can see the H2S by blackening. Okay, so that if you see Proteus, one we said urease positive, so we put a urease positive test. And also TSI, blackening of the medium in the bottom. Okay, so it is indicative of hydrogen sulfide production, H2S production. And also citrate. We said citrate is negative, So the indicator is not changed, and you can see a negative citrate reaction. And MR positive, VP negative. Okay. So both Vogt-Prosker and citrate are negative. So we have put one negative Vogt-Prosker and one negative citrate. And MR is positive. And indole is doubtful, so we didn't put indole. Nitrate is also positive, and so we put up a nitrate test. And purposefully, I reddened those two areas which are not given to you. Okay. So these are the practical aspects. A patient comes with pain in the ear and ear discharge, and we have inoculated into certain media, and we have conducted certain tests. Please interpret. That is the question usually that is given in the clinical microbiology or applied microbiology section. So you are supposed to say that it may be a case of superior otitis media, and because you are saying the ear is discharging and it is maybe history is 3 to 4 months, it is chronic superior otitis media, can be caused by Proteus, and blood agar showing the swarming pattern and all, and also some non-lactose fermenting growths on the agar, and also the microscopic figure. If microscopic figure is produced, gram-negative bacilli are shown, and the reactions, IMVIC reactions, MR positive, BP negative, citrate negative, and urease positive, and TSI, the hydrogen sulfide production positive, and nitrate is positive. So it can be Proteus. Okay. So whether it is vulgaris or mirabilis, at undergraduate stage, we don't really bother, and they might ask you if you have done so well, what is the difference? But anyway, for an undergraduate, we'll be happy if you can identify the given case as CSOM, and the organism is Proteus, and the reactions. That is the thing about. Okay. So we said something about the antigenicity also. Motile strains, somatic O-antigen, H-antigen will have. And somatic is O-antigen and flagellar is H-antigen. And Proteus mirabilis, 32 O-antigens are there. Vulgaris, 32 O-antigens are there. On the basis of O-antigen, Proteus mirabilis and vulgaris, they are again subdivided into 54 serogroups, H-antigen, serotypes. Now, you should know something about the Weil-Felix reaction. In rickettsial diseases, when you talk about rickettsia, this will be covered much more extensively. But here, there may be a short question, heterophile antigen. That is, beyond kingdoms, an antigen is shared. So this is bacterial kingdom, plant kingdom, human kingdom. So here, if you see, the non-motile Proteus strains of OX19, OX2, and OXK are shared by some of the rickettsia. Why they are shared, we don't know. God or the supernatural power has put up like that. And you can identify them by doing a Weil-Felix reaction. And Weil-Felix is a heterophile antibody test. Okay, so this we know that we can use Proteus also for a different purpose, CSOM, or as an agent for diagnosis of some rickettsial diseases with non-motile variants. The motile variants do exhibit swarm motile variants, non-motile variants. We can use them. These are two, OX19, OX2, and OXK. because they are shared by some rickettsia also. So what about the pathogenicity? It is, the Proteus is available in soil, water, and fecally contaminated material, moist areas of skin. Proteus mirabilis is an opportunistic pathogen and nosocomial infections. As you said, nosocomial is nosocomion is not an English word. They signify places where diseases are treated. That is awesome. So, HAI, hospital acquired infection. Predisposing factors. That is, people like older people where the immunity is less, or where there are structural abnormalities of the urinary tract, or maybe diabetes if they have, and various forms of urological instrumentation, like catheterization and also. So you can have some urinary tract infection also because of Proteus. So where all the things you think of Proteus, one is ASOM or CSOM or urinary tract infection, then you can think of this. And predilection for the upper urinary tract, it is serious formation of cavity in the urinary tract. So, wound infection, bed sores, osteomyelitis, hyperammonic encephalopathy are common. There also you can think of Proteus infection. Umbilical stump infections, bacteria and meningitis, and it's also recovered from the immunosuppressed host. So this is the reason why the history is more important. The person who is writing the requisition on TRF, test requisition form, should give enough history that from the sample has come. Suppose you just write swab, it doesn't mean anything. Is it an ear swab? Or something from a wound swab? And which part of the body you have collected? All these things are. So that is the end of infection by Proteus, and what practical points you may get to see in Proteus. So one of the questions may be acute suppurative arthritis media or chronic suppurative arthritis media, and maybe urinary tract infection. Maybe that is where your history counts. Okay. So to come to a diagnosis of Proteus, you should go through the history proper. Okay. Now here you see a picture of a person pouring some oil into a pan, and it's obviously a gas burner, and there are some eggs. This is not an advertisement for using an oil or using eggs. And the next stage you can think of is there is some oil splash on the face, or if you are not careful enough, the oil which is not may go on your skin. Okay? Or somebody else, without knowledge, they'll come and touch the oil thinking that it is cool. So there may be some burning. So burn injuries also are usually infected by Pseudomonas. That is why if you go to a hospital ward, a burn swab, the smell is typical. Okay, so now we will see something about Pseudomonas. Okay, Why it is represented in so many colors? As Pseudomonas produces either red or blue, green, or brown pigments. That is the reason why. Now, we try to give you a clue even in the colors that are produced by Pseudomonas. Obviously, this is an electron micrographic picture, wherein again you have seen green color. Okay, so they're trying to give you a visual impression so that it may produce a greenish blue or reddish pigment or a brownish pigment. So this is, just remember the color of the letters. You think that it is a pigment producing organism. Okay. So again, to refresh your theoretical knowledge, we will say that it is a aerobic organism, negative in nature, just like Proteus, and it is a non-fermentative pest. Okay. So regarding Proteus, we said there is only fermentation of glucose, but here it is a non-fermentative pest. It may have something like 200 species, and some produce pigments which are diffused in pigments, which are, suppose you have some money in the bank or money in the purse. If you are giving it away, it is a pigment that is spreading. But if you are having it and you are not giving it anymore, it is something like within the colony that pigment is there. Suppose Staphylococcus aureus, golden pigment, golden yellow pigment is produced. The colony looks that color, but the medium doesn't look that color. Okay, so that is where you see whether it is diffusing into the surrounding medium. So here, what is it? It is a diffusible pigment. So the pigment that is produced by Pseudomonas gets into the medium also. That is what you have to understand and remember. Saprophyte mana, it can live or even non-living things also distributed in soil, water, sewage, decomposing organic matter. So it is almost everywhere. So basing on the RNA DNA homology, Pseudomonas have been classified into various genera. So one is Pseudomonas, other is Bacteria, Stenotrophomonas, Comomonas, and Brevindimonas. Okay, so these are all the various. But right now, for the practical purposes, we are interested in the genus Pseudomonas. And the two medically important Pseudomonas aeruginosa, that is the most commonly isolated organism, and Bacteria malei and Sequacia, Stenotrophomonas, Maltophylla. These things we are not concentrating now because practically we are concentrating on Pseudomonas. Coming to Pseudomonas aeruginosa, colonization occurs most commonly in hospitalized or immunocompromised hosts. For example, one is admitted for some problem, say maybe hernia operation, vertical operation, or maybe some acute gastritis, suspecting some peptic ulcer disease. They have admitted. And somebody else is admitted with some other problem, and there may be a hospital-acquired infection. That is, by admitting into hospital, you are getting another infection which you are not exposed to. That is hospital-acquired infection or immunocompromised patients who are immunocompromised. Maybe because of HIV, a patient is on drugs. Even HIV itself causes immunosuppression. and you take certain of the drugs or organ transplantation. Suppose you have taken a kidney transplant and you are using drugs lifelong to suppress your immune system and so that the kidney is not rejected. Okay. So these are examples of hospitalized patients or immunocompromised patients. And some sites are common, like gastrointestinal tract, GIT, and moist body sites, like the axillae and pleurae. And also throat, nasal mucosa, axillae, and perineum. Again, to refresh your theory part a bit, and of course, it is important for practical also. A slender 1.5 to 3 micrometers into 0.5 micrometers in size. That one. Always when I tell about Pseudomonas, I give an example. Suppose you hit a car window, front window. What happens? There may be some injury to the glass, but the glass pieces won't come and fall. There is a fiber inside, and it goes like a smithering, like such a picture you see when Pseudomonas is there. So, slender bacilli. Okay. Motile and polar flagella. Earlier we have seen peritracheate flagella, that is around the body. Here, polar flagella, occasional 2 or 3 flagella may be there. Okay, on the one day, shower mode imagine with its own fashion which so remember polar flagella, occasionally 2 or 3 can be there. And it is non-capsulated, and most of these strains are fimbriae. So fimbriae is there, and fimbriae is an organ of adhesion. Again, you can see under the electron microscope, these pictures are shown. And it is aerobic, but it can grow anaerobically also. And optimum temperature. You see, when a thing should survive, it will have a wide range of temperature. So Pseudomonas, we say that it can infect in variety of areas and variety of environments. So its temperature tolerance is more, 5 to 42 degrees centigrade. And it should be able to grow everywhere. So, nutrient agar mere berutundi, blood agar mere berutundi, chocolate agar iste inga baga berutundi. Colonies are 2 to 3 millimeters in size. Smooth and translucent, irregularly round, emit a fruity water. Remind you and mind you, Pseudomonas odor is addictive. Yes, whenever I see a water of Pseudomonas, I like to be there because it is sweet water. The infection is very dangerous to treat, but it is a very sweet water. Fruity water. Amino acetophenone is the chemical that is responsible for the sweetness of the water. Okay, so fruity water is a one. And McConkey agar, as you can see, non-lactose fermenting colonies. If you want to say correctly, lactose non-fermenting colonies. See, blood agar, there are about 2 to 3 colonies. And nutrient agar slope, you are seeing the pigment production, maybe greenish or maybe reddish pigment to be produced. And also the green pigment. And Pseudomonas aeruginosa, that is the pigment producing, and Pseudomonas fluorescens, it produces a pigment which is reddish or brownish in color. And this I have shown with a purpose. Can you imagine what the purpose is? The purpose is to show that it diffuses into the medium. So you can see the colors, and you can see the medium also colored at some places. Okay? So this is how a nutrient adaptate is looking after Pseudomonas is inoculate. You can see the colors and you can see the pigment diffusing in the colors. So in a question, suppose a person is having a history of burns, is admitted with burns in the hospital, and a swab is taken from the pus that is from the wound, burn wound, and you are shown a medium where the pus is inoculated, and also some biochemical tests and a microscopic picture is given, as it will say. First you see the pigment, and if it is diffusing immediately, you think of Pseudomonas and see whether the history is coincident. So now, what are all the pigments that are produced? They might ask you in the question, clinical examination. No, clinical microbiology, practical examination. What are all the different pigments produced by Pseudomonas? One is biocyanin, bluish green phenacetin pigment, soluble in chloroform and water. Forget about this chloroform and water business. Okay? Say that bluish green phenacetin pigment, biocyanin. One of the most dangerous things an ophthalmologist operates upon very carefully. But there is some infection and blue pus producing organism. Finished. The eye is gone. The eye is gone. So that is why you have to be very careful. You should be very thorough with the sterilization of the instruments. One of the common infections is in the eye. Operation done, but operation success, but patient lost his sight because of infection. Pyoveridin. So this is the fluorescent pigment, but greenish yellow fluorescence colors under UV light and insoluble in chloroform, soluble in water, produced by Pseudomonas fluorescens and putida. Pyorubin. So that's why I put red color, bright red, water soluble pigment, insoluble in chloroform. Enough if you say that the pigment division can be found out by using either chloroform or water, because it may be difficult to remember which pigment is soluble in water. Okay. And pyomelanin. So melanin, if you think it's a thing that gives color to the skin, and usually a brown-black pigment, 10 to 15% stains of Pseudomonas aeruginosa do not form any pigment. This also should remember. So it doesn't mean that Pseudomonas means pigment production. So 10 to 15% of the stains need not produce any pigment. So this also you remember. So to recollect pyoveridin, pyorubin, pyomelanin, and pyocyanin. These are the pigments that are produced by Pseudomonas. And coming to biochemical reactions, oxidase is positive, catalase is positive, citrate positive. So we have shown earlier the citrate negative, but you are seeing a citrate positive reaction here. And you know how oxidase is performed and how catalase is performed. Okay? So they might provide you with the oxidase test result and catalase test. You are supposed to do it, I know. And utilize carbohydrates oxidatively by Hugh-Lifson's method. Probably this we will not keep for you at undergraduate level. And glucose acidification is seen, indole MRVP negative. So already we said it is a non-fermentative bacilli. And indole MRVP citrate, if you see, negative, 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 IMV, IC, indole, MR, and VP negative. Citrate is positive. So we give you the first three negative, and the last one positive. And also oxidase and catalase we are keeping positive. And also heat resistance. You know, this is a test also we can see. Suppose you want to purify a given culture. Pseudomonas is not killed at T is up to 20 degrees centigrade for 1 hour. So when you heat, if something is living even at the temperature, you call it as Pseudomonas. And you can get a purer strain. Exhibit resistance to many antiseptics, many disinfectants, and many of the antibiotics which you use. So that is why it is very difficult to treat a Pseudomonas infection. Very difficult to clean the hospital surroundings also, where especially the Pseudomonas is there. See, actually, we use antiseptic solutions like Cellizol or Cresol or something to clean the floor and mop the floor. They are not only resistant, but also they like it. Okay. So, phenol agar. Okay. So, there may be so much that they can grow in that solution, sensitive to acid, and some of the antiseptic lotions. Okay. So that we use Savlon. Savlon cetrimide agar. So it is good for growth of Pseudomonas. So that is why the purpose of putting a Chittle's forceps for dressings and Pseudomonas growing in those dressings, and that is how we infect the eye cases. So please don't use. Take a sterile bin, only from that you use. And sensitive to acid, beta-glutaraldehyde, strong phenolic disinfectants, and silver salts. This is the resistance factor. And toxins and enzymes, one practically important point is pyrocyanic in extracellular products. The pigment that is produced, it inhibits mitochondrial enzymes and cessation of ciliary rate, and especially in nasal epithelium, colonization of the organism. So this is a practically important theory point. So depending on various methods you can type. You can type by serotypes or bacteriocin typing. So here, most popular method of typing is Pseudomonas aeruginosa. Is bacteriocin typing, easy to perform, results available on Untitled. So one extra question if they are asked, how do you type the Pseudomonas? One type of typing is by seeing the pigments. Okay. Another is by bacteriocin typing. Again, here pathogenesis, why you are seeing? Because it is widely available in nature, just like Proteus. Distributed in water, sewage, soil, air, and human skin. Pseudomonas aeruginosa acts as an opportunistic pathogen. What is this opportunistic pathogen? Suppose I am healthy. Pseudomonas, if there is an invasion about my skin, it is present also, it can't cause it. But my immunity is a bit down. I have fever, I have cold, or I have some other disease. So the Pseudomonas takes upper. This is called an opportunistic pathogen. That is, it is present there, but it takes an upper hand when there is another immunity reducing condition. So mode of infection, it can come from the environment or it may be contaminated hospital equipment, that is from cross infection, and accounts for 5 to 15% of all those infections. That is why you should be very careful about Pseudomonas. So now, clinical syndrome, blue pus producing organism, opportunistic and nosocomial infections. And common infections can be urinary tract, UTI, wound and burns infection. That's why burns wound and all. If you have the same smell, fruity smell. And this also can cause CSOM, chronic subacute bronchitis maybe. So you can see the various infections that are caused, hemorrhagic necrosis of skin in various parts. Okay. And see the infection of the eye. Around the cornea, there is vascularization. And there is hyphema, that is formation of pus in the anterior chamber. In the lower part, you can see the collection. So it's a very dreadful sight for an ophthalmologist who operated upon. Very difficult to see. You can also infect the nails. You can see the bluish green pigment under the nail. Okay, so the various infections we have shown. And it can also cause eye infection. And acute purulent meningitis, when you do lumbar puncture, or in case of road accidents, a cranial injury, there may be certainly it may be infected with Pseudomonas. Respiratory infections, necrotizing pneumonitis, contaminated respirators. Septicemia, that is newborn and old elderly persons, and acute necrotizing vasculitis. Hemorrhagic infections of the skin, just now we have seen the photographs, and infantile diarrhea. So these are all the various causes or various syndromes where you can encounter Pseudomonas. But in your practical examination, we will give you the burns ward patient. Okay, the patient still burns is admitted, and a microscope picture is given to you, and some of the tests that are provided to you, and some of the media are inoculated with the pus, and they are shown, and interpret and give you a diagnosis about the organism and explain the test. That is how the question can be. So coming to laboratory diagnosis, pus can be a wound swab, pus swab, or pus itself, urine, CSF, sputum, or culture. It can grow anywhere, nutrient or molar internal, or diffuse bluish, greenish pigment, or reddish pigment, or brown pigment. So if you can see the pigment, and you see by the diffusion of the pigment also. And fruity water, grape-like water, is a pale flat colonies with a spreading border, you can see. Okay. Selective media, cetrimide agar. Cetrimide is nothing but your savla, and we told you it not only tolerates, but also it can grow in the presence. That is the height of tolerance. And characteristic colony morphology and gram appearance. gram-negative, and grade-like order, biochemical reactions, positive oxidase test, TSI-agar reaction, alkaline overload change, bright green diffusible pigments are non-dye containing oils. Okay, and growth at 42 degrees centigrade. So, to summarize, Proteus and Pseudomonas, they are encountered in day-to-day infections that might cause in the hospital, especially if it is practically, we give you an ear infection history and all for Proteus with a swarming plate that is better, and also a gram-negative focused slide, and some of the immune reactions which are suggestive of Proteus. And you have to write about some important points. And you can also say that the heterophile antigens OX19, OX2, and OXK are useful in diagnosis of rickettsial diseases. That is about Proteus. And they will ask you about Dine's phenomena, where you will say whether the given strains are identical or not identical. You can see by the swarming. If the swarming is stopping, falling short, they don't belong to the same. And if they're belonging to the same variety, and there is an intermingling of the swarming area. Coming to Pseudomonas, Pseudomonas aerogenesis is important, and it is a non-fermenter and catalase oxidase and citrate positive. So the other reactions of Pyrimidic, I and VI are negative, and gram-negative picture is seen. The pigments are produced, which are diffusing into the medium, and so that is the reason why I read the history of burn wound infection is given. So you say it is a Pseudomonas species, maybe originals, maybe something else. No. Enough if you say it is Pseudomonas infection. So these are the practical points that are covered under Proteus and Pseudomonas. This may be clinical or applied microbiology exercise for you. So remember and read and refresh your knowledge today. Right then, bye. We'll see you again with some other class. Okay. Thank you. And do not forget to wear your mask when you go out. SMS, that means sanitization, mask, and nowadays there is a sort of difference. Not to call it a social distancing, it is physical distance or safe distance. Okay, 6 feet is a safe distance. So SMS, don't forget. Thank you. you.